Module 1. What is Community Engaged Research, or CEnR, and why should we consider this type of research? The following modules were created, like all good community work, through a collaborative process that included the team at the Southern California Translational Science Institute Office of Community Engagement, the Scripps Research Translational Institute Community Engagement Program, the Scripps Whittier Diabetes Institute Project Dulce, as well as members from the communities we serve. We thank you for all your support and feedback. The Scripps Research Translational Institute, or SRTI, Community Engagement Team consists of the following members. You are welcome to contact the team with any questions or comments. This instructional course consists of 3 individual learning modules. This first module will discuss community engaged research, and we'll explain what it is and why we should consider this type of research. There are 2 other videos on this channel as well. Module 2 will assess strategies for implementing a community-engaged project. Module 3 will review potential barriers to successful research and consider solutions to these problems. Before we begin Module 1, please click on the following link to complete the Module 1 pretest in the description below. The objectives of this module are to understand the principles and goals of community-engaged research, or CEnR, compare CEnR to other research methodologies, and review specific examples of the Scripps approach to community engagement. Let's review an example of CEnR in action. Genomics researchers can look at an individual's genetics to understand how traits, such as eye color, or diseases are passed on within families. Although Latinos are at a disproportionate risk for developing type 2 diabetes, there has been low participation by this group in diabetes genomics research. Thus, there is a need to carefully identify barriers to research participation, increase awareness, and facilitate access to clinical and genomics research among Latinos and other underrepresented groups. Dr. Liliana Uribe Bruce, an endocrinologist, initiated a study during her postdoctoral training at the Scripps Research Translational Institute. The goal of her study was to collect blood and saliva samples, along with health data from Latinos of Mexican ancestry who were diagnosed with or at risk for type 2 diabetes. How did this program meet the needs of the community? Unfortunately, at first, it didn't. Although the storage bank was purchased and the Institutional Review Board, or IRB, had approved the study, issues arose when participants were in the process of consenting to join the study. Some participants did not genuinely understand the concept of genomics, and others seemed uncomfortable participating in a formal research study. Please note, the IRB is the committee used in research in the U.S. that formally approves, monitors, and reviews biomedical and behavioral research. They ensure studies are both safe and ethical. In what ways could Dr. Uribe Bruce have better tailored her research study to the population of interest? A. Talk to her coworkers more extensively about study design. B. Research the impact of genomic studies on healthcare policy. C. Ask the Latino population about their feelings and knowledge regarding genomics and research studies. Answer C is the best answer. Asking the Latino population about their feelings and knowledge regarding genomics and research may have enabled the study to have run more effectively. This demonstrates a challenge to CEnR, which is ensuring that the community understands what they are consenting to, and that they are comfortable participating in the study. So how did the research team overcome these issues? The research team worked with the community to develop a culturally tailored module to educate its members on the basics of genomics. The interactive module was designed using a PowerPoint presentation, which was 30 minutes long and facilitated by a peer educator. These educators consisted of lay people from the community who support health promotion by engaging and teaching their peers. The material was also presented in Spanish to ensure it was fully understood by study participants. A survey about heredity and diabetes was also created to understand the community's opinions about heredity and health. This survey was completed before and after the educational module to ensure participants understood the material presented. Both the educational module and the survey were created with input from the patients, community health workers, members of academic institutions, and others. Data collected from the survey showed that knowledge regarding research and genomics did in fact improve from the pre- to post-educational surveys. Remember, the community plays a big role in defining relevant questions that not only make sense, but also meet the needs of the community. And it all starts with open communication. Now it's time for a quick quiz. In CEnR, what aspects of the research process can community members become involved with? A. Research question generation. B. Grant writing. C. Data collection. D. Analysis and interpretation of findings. E. All of the above. All of the answers above are correct. Community members can be involved in all aspects of the research process. Now that you've seen an example of community-engaged research in action at Scripps, let's talk about how CEnR is defined. CEnR is a collaboration between community members and researchers, in which both groups contribute equally and in all or most phases of research. It is built on a foundation of trust, collaboration, and shared decision-making. The CDC defines community engagement as the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interests, or similar situations to address issues affecting the well-being of those people. The goals of CEnR are to build trust between researchers and the community, enlist new resources and allies, create better communication, improve overall health outcomes, and ultimately to evolve into lasting collaborations. Let's take another quick quiz. Which of the following are included in the definition of community? A. Hospitals. B. Schools. C. Patients. D. Patient support persons. E. All of the above. All of the above answers are correct, as all of these people and networks can be included in the community. Who is included in the community? We can start with the patient or participant, but also includes a whole network of community members. This includes, but is not limited to, support persons and those in the patient's immediate social network, such as a friend, family member, or religious figure, clinic or community staff, such as a front desk personnel or a peer educator, clinical providers, such as a nurse or physician, the health system administration, such as a hospital CEO, researchers, fellows and trainees, such as medical students involved in the research process, organizational research partnerships, such as a collaboration with other academic centers, and finally, community leaders and policymakers, such as local political representatives and the government at large. It is also important to understand what constitutes research and how CEnR is different than traditional research. Research is broadly defined as the search for knowledge, or as any systematic investigation to establish new facts, solve new or existing problems, prove new ideas, or develop new theories. Research can take diverse forms, serve many purposes, and be conducted in various laboratories, clinical, or community settings. In traditional, community-placed research, the researcher initiates the research question and develops the study design with little to no community input. In contrast, in CEnR, the community plays a primary role in defining relevant research questions, conducting the research, and disseminating the results. Community members may also choose to approach researchers about a question they are interested in pursuing. Time for another quiz. Community research partners can have the following roles in CEnR except A. Community Advisory Board, CAB members. B. Participants. C. Co-investigators on a grant proposal. D. Research staff. E. Co-authors on peer-reviewed manuscripts. Option B is the correct answer. Community research partners should not be participants in the research study. CEnR is defined by multiple characteristics with an emphasis that community members and researchers contribute equally and in all or most phases of research. Furthermore, CEnR is characterized by the following attributes. Trust, collaboration, and shared decision-making are integral parts of the process. Researchers and community members recognize and embrace each other's expertise and skills. The community is recognized as a unit of identity. Partners commit to long-term research relationships that are mutually beneficial to both parties. Core elements include local capacity building, systems development, empowerment, and sustainability. Now that you've learned more about community-engaged research, let's summarize how it's different from other research modalities. We are going to compare traditional or community-placed research, community-engaged research, or CEnR, and community-based participatory research, or CBPR. Community-based participatory research, as seen in the third column, is a subset of community-engaged research that has even more emphasis on the community. In this mode of research, the community is fully involved in all aspects of research, and there is both less initiative and less involvement of the traditional researcher role. In traditional research, the study design is based on the researcher's interests and funding. Study design is based on scientific rigor and feasibility. In CEnR, the study is designed with community input regarding relevant issues and to ensure the study design is culturally acceptable. In CBPR, the community fully identifies issues of importance and is intimately involved with the study design. In traditional research, the recruitment and retention plan is based on scientific issues and the best guess as to how to reach members of the community. In CEnR, there is a community guidance on recruitment and retention strategies. In CBPR, in addition to community guidance on recruitment and retention, the community actively participates in the recruitment process. In traditional research, study measurements and instrument design are adopted from other studies and conducted by researchers or individuals with no connection to the community. In CEnR, the study design is adopted from other previous studies and adapted to fit local populations. community members are involved with some aspects of data collection. In CBPR, the study instruments are developed with community input and tested in similar populations. Data is collected by the community to the greatest extent possible based on available skill sets. In traditional research, interpretation and dissemination is done solely by researchers who generally control access to the data, conduct analysis, and interpret findings. Results are published in peer-reviewed academic journals. In CEnR, researchers share results with the community for comments and interpretations. Results are disseminated in community venues as well as in academic journals. In CBPR, the data is completely shared and community members and researchers work together to interpret results. Both parties identify appropriate venues to disseminate results. The Clinical Translational Science Award, or CTSA program, is funded by the National Institute of Health, or NIH. The NIH is the main agency of the U.S. government responsible for biomedical and health-related research. The goal of the CTSA is to support research across all phases of the translational science spectrum. The Scripps Research Translational Institute, or SRTI, along with Scripps Health, work together as one of 62 research hubs created through the CTSA program. Under the leadership of Dr. Eric Topol, Scripps has created major programs in both research and education/training that bridge science with medicine and industry. There are 4 main research targets at SRTI: translational genomics, digital health, informatics, and drug discovery. At SRTI, there is an emphasis on all dimensions of translation, between the bench, bedside, and community. This includes research that takes a traditional role in bringing bench research to the bedside. It also includes more translational methods that involve bringing research from the bedside to the bench and back to the bedside. They also strive to bring the bedside to the community and the practice of medicine. The SRTI Community Engagement Program is led by the Scripps Whittier Diabetes Institute at Scripps Health. The Community Engagement Program provides consultation services to researchers and community organizations interested in incorporating CEnR principles into their research. Their aim is to ensure researchers effectively engage with community organizations and key stakeholders to identify research questions and produce results that are relevant to the community. Here is a general idea of the community engagement process. First, we elicit input from all layers of the community regarding the potential study. Feedback from the various community members can be obtained through advisory board meetings, focus groups, key informant interviews, or self-report surveys. Next, this input is used to help generate design plans for the program or project and help with grant proposals. Once again, feedback from the community should be elicited before proceeding. Input from community members should be used to alter the existing plan and fine-tune the goals moving forward. Now we can proceed with implementing the program or project we have been designing. Don't forget to get input again from the community. It is essential that the community be involved in every step in the research process. Here's an example of how the ongoing community engagement process looks at Scripps. It all starts with the Community Advisory Board, or CAB, that is comprised of diverse stakeholders from the community of interest and is also open to the general public. To kick off the dialogue, CAB members and the public are invited to attend an annual health forum to identify topics of interest in their community. Hot topics that emerge from the annual forum are then discussed in greater detail at subsequent quarterly breakout meetings. In an effort to maintain ongoing bidirectional communication with all members of the CAB, monthly email blasts are sent to the membership with updates and opportunities to provide feedback. If there is a desire to reach an extended community, researchers can consider a web-based engagement approach to work around geographical barriers. The greatest take-home point is this: the community engagement process is continuous. Here's one final quiz. Community-engaged research can be an excellent way to facilitate the discovery of innovative solutions to difficult and current community health problems. A. True. B. False. Answer A is correct. This is a true statement. Why should one do CEnR or CBPR? To facilitate the translation of research into meaningful health improvements for all communities. To ensure that research questions, data, and programs are based on community needs and meet standards of scientific integrity. To increase the relevance of research questions, data, and programs, while ensuring they are devised and implemented in concert with those directly affected by the disease. To facilitate the discovery of innovative solutions to difficult and current community health problems. To collaborate on a project that can improve sustainability, dissemination, replication, and policy impact. Community-engaged research often has benefits that outlast research. And lastly, to strengthen the research and program development capacity of all involved. Community research can benefit both researchers and community partners. Why do community-engaged research, CEnR, or community-based participatory research, CBPR? For researchers, they can grow relationships with the community and learn about community health needs, assets, and policy implications. By ensuring acceptability and relevance, researchers may find it easier to achieve recruitment goals and study aims. For community partners, this type of research can help the community increase exposure to important resources and knowledge about current evidence-based practices. They can also learn about methods of program evaluation to create more opportunities for funding and collaboration. If you're wondering if community-engaged research is a good fit for you, ask yourself the following questions. Do I possess the patience needed to work with a diverse team to learn things I may not know anything about and teach others my skills and experience? Do I have a burning, genuine curiosity about how people live and what other people's jobs entail? Do I possess or am I willing to learn the interpersonal skills necessary to build long-term, lasting partnerships? Am I willing and able to mentor and inspire others? Do I have the ability to share control, to lead and be led? Do I want to make community concerns the focus of my research, project, and/or program? As a researcher, am I able to supplement my scientific skills with humility? As a community partner, am I committed to learning the research process, sharing information on issues that are important to me, and participating on a research team? Do I have a commitment to self-evaluate, ensure an equal power distribution exists, and develop a mutually respectful partnership with communities? Let's summarize what we reviewed in Module 1. CEnR reflects a collaboration between community members and researchers who contribute equally and in all or most phases of research. CEnR is built on a foundation of trust, collaboration, and shared decision-making. The goal of CEnR is ultimately to facilitate the translation of research into meaningful health improvements for all communities. Thank you for completing the Conducting Community-Engaged Research, CEnR, Module 1. What is CEnR and why should we do it? To complete the Module 1 post-test, please click on the following link in the description below. Interested in learning more? Look for our other modules on this channel. Module 2 reviews strategies for implementing a CEnR project. Module 3 discusses how to problem-solve potential barriers to CEnR. For more information, please contact us at communityengagement@scrippshealth.org.